The circulatory system is one of the most important systems in the body. The circulatory system consists of three independent systems: the heart or cardiovascular system, the lungs or the pulmonary system, and the arteries and veins or the systemic system. So what is blood? An average adult has 5 to 6 quarts of blood, which is made up of plasma, red blood cells, white blood cells, and platelets. Red blood cells, called erythrocytes, carry oxygen throughout the body. White blood cells, called leukocytes, fight infections. Platelets, called thrombocytes, are cells that clump together to stop bleeding. And plasma is a yellow, clear liquid that carries nutrients, hormones, and proteins throughout the body. In addition to blood, the circulatory system moves lymph, which is a clear fluid that helps the body get rid of unwanted material. Capillaries are the sites of exchange of materials between blood and the surrounding tissues. The walls of capillaries are very thin, usually only 1 cell thick, which allows materials to diffuse out of the capillaries. There are several different types of blood. Blood types are determined by the presence or absence of 2 antigens. A antigen produces blood type A, B antigen produces blood type B, A and B antigen together produce type AB, and the absence of A and B produces blood type O. Blood types also include whether the individual has the Rh factor. If they do, their blood type is positive. If they don't, their blood type is negative. For example, if a person is told they have blood type AB positive, they have both the A antigen and B antigen as well as the Rh factor. Blood transfusions are only successful when the matching blood type is given. If they don't match, red blood cells clump together, which is called agglutination. How does blood move through the body? The heart is the organ responsible for getting the nutrients and oxygen the blood carries to different parts of the body. The heart is responsible for keeping the oxygen-poor blood separate from the oxygen-rich blood, keeping the blood flowing in one direction, and creating blood pressure. The heart is found in the thoracic cavity between the lungs. The heart is a little bit bigger than the size of your fist. The heart wall is comprised of 3 layers: the epicardium, which is the outer layer of the heart, the myocardium, which is the middle layer of the heart, and the endocardium, the inner layer of the heart. The heart has 4 hollow chambers: the right atrium, the right ventricle, the left atrium, and the left ventricle. Blood passes through the heart in this sequence. The 2 largest veins in the body, the superior and inferior vena cava, bring the oxygen-poor blood into the heart into the right atrium. This oxygen-poor blood then passes through the tricuspid valve into the right ventricle. The tricuspid valve closes after the blood passes through to prevent it from flowing back into the right atrium. The right ventricle fills and contracts to pump blood into the lungs. The right ventricle pumps blood through the pulmonary valve into the pulmonary artery. Once blood passes into the pulmonary artery, the pulmonary valve closes to prevent backflow of blood into the right ventricle. The 2 branches of the pulmonary artery carry blood to both lungs. In the lungs, the blood picks up oxygen and expels carbon dioxide. Reoxygenated blood leaving the lungs enters the heart through the pulmonary veins and is carried into the left atrium. The reoxygenated blood then flows through the mitral valve and into the left ventricle. The mitral valve closes after the blood passes through to prevent backflow. The left ventricle, the most muscular chamber of the heart, then contracts with enough pressure to send the blood through the aortic valve and into the aorta. After the blood passes through the aortic valve, it closes to prevent backflow of blood into the left ventricle. The aorta branches into arteries, arterioles, and capillaries as it delivers blood throughout the body. At the capillaries, the blood delivers its supply of oxygen and picks up carbon dioxide. It then begins its journey back to the heart, through the veins, and back into the inferior and superior vena cava for the process to begin again. How does the heart beat? A heartbeat is caused by an electrical impulse traveling through the heart. The heart's built-in electrical system controls the speed of its pumping. The electrical impulse originates in the sinus node, which functions as the heart's natural pacemaker. The sinus node is located in the top of the right atrium. The electrical signals travel through the heart tissue, causing the atria and ventricles to contract and relax and the blood to be pumped to the body. It's amazing that our heart repeats this process an average of 100,800 times per day. One common problem that occurs within the circulatory system is varicose veins, which affects an average of 3 million people per year. Varicose veins are swollen, twisted veins that you can see just under the skin. They usually occur in the legs. Veins have one-way valves that keep blood flowing toward your heart. If the valves are weak or damaged, blood can back up and pool in your veins. This causes the veins to swell, which leads to varicose veins. Varicose veins are very common. You are more at risk if you are older, a female, obese, don't exercise, or have a family history of varicose veins. They can also be very prevalent in pregnancy. Doctors treat varicose veins through several different methods depending on how severe they are. Some of the common medical treatments include laser surgery. This procedure applies light energy from a laser onto a varicose vein. The laser light makes the vein fade away. Laser surgery mostly is used to treat smaller varicose veins. Microsclerotherapy is used to treat spider veins and other small varicose veins. A small amount of liquid chemical is injected into a vein using a very fine needle. The chemical scars the interior lining of the vein, causing it to close off. Ambulatory phlebistomy. For ambulatory phlebistomy, the doctor will make small cuts in the skin to remove small varicose veins. This procedure is usually done to remove the varicose veins closest to the surface of the skin. The patient is awake during this procedure, but the doctor will numb the area around the vein. Some alternative treatments for varicose veins include garlic. Garlic is an excellent herb for reducing inflammation and the symptoms of varicose veins. It also helps break up harmful toxins in the blood vessels and improve circulation. To do this treatment, you slice up 6 garlic cloves and put them in a clean glass jar. Extract the orange juice from 3 oranges and add it to the jar. Also add 2 tablespoons of olive oil. Let the mixture sit for about 12 hours. Shake the jar and then put on a few drops of the solution onto your fingers. Massage the inflamed veins with the solution in a circular motion for 15 minutes. Wrap the area with a cotton cloth and leave it on overnight. Repeat daily for several months. Another home remedy for varicose veins is the marigold flower. Boil 1 cup of marigold flowers in 4 cups of water for 5 minutes. Soak a cotton cloth in the solution and place the cloth on the affected area. Leave it on until it completely cools. Repeat several times a day for a few months until you notice improvement. You can also eat fresh marigold petals to achieve the same results.
It's important to look and feel good about yourself. That's why you shouldn't let ugly spider veins stop you from showing off your beautiful legs. The Vein Treatment Center offers real removal solutions that involve no invasive surgery, and our revolutionary removal techniques require virtually no recovery time. You can go back to work the very same day.
If I can have legs like this, there's no reason why you can't. Call the Vein Treatment Center today.